Hello, everybody. Welcome. I see some new faces here in the Nutrition Theater. Is this your first time here? Or long time ago. Well, welcome. Well, welcome to our folks at home and those here in the theater. I'm Jackie Carlin, the Community Education Director here at the Center for Health and Wellbeing. We're very excited for this. This is a topic that people have been asking us to host for years. So we are very grateful to Dr. Swain, who I'll introduce in a moment, for joining us for this. So first, I'm going to introduce Allison Harrell, who many of you know. Allison is a registered dietitian nutritionist, plant-based chef, and she's been doing this for more than 25 years, working at the corporate level, the clinical level, on the one-on-one client level, but mostly important to us at our level here. So we're always happy to have Allison here a couple times a month. She's also a certified culinary medicine specialist and has a certification in weight loss management. So she's going to help you. One of the philosophies I love about Allison is helping us learn what to eat, not necessarily what not to eat. So you eat all these wonderful things, you're not worried about the other things. So we're excited for that. Dr. Omar Swain is going to be joining us as well today. Say hello to the folks at home real quick. You can wave that way.
Hello, everyone.
Hi, welcome. Have a seat. So Dr. Omar Swain actually practices right here in the Center for Health and Wellbeing, joining us for the very first time in the Nutrition Theater. He's upstairs in Dr. McCarris's office, and together he was a fellowship-trained, board-certified, minimally invasive gynecological and robotic surgeon. So he deals with a lot of issues such as fibroids and other gynecological programs. And Dr. Swain and I had a really great conversation last week about weight management and the role of nutrition in it, so I'm really excited for you guys to learn from what he has to say. He also strives to provide excellence in gynecological care through evidence-based medicine and some of the most advanced minimally invasive procedures. And he's fluent in both English and Arabic. So if anybody has a question at home and he'd like to answer in Arabic, just let us know in the chat. A couple housekeeping issues. So as you can see, we've got folks here in the theater. We got folks watching along from home. We're going to record this entire session and send it out to everybody who registered. So if you learned something today, we hope that you will share it with others. This is a casual conversation. So if you have a question throughout the way, do you need a pen? Oh, I've got one. All right, sorry. Okay. If you have a question throughout the way, just interrupt whenever the moment strikes. Don't feel like you need to hold your questions till the end. So it can be on things about technique. It can be about specific ingredients. The one thing we always say is, Dr. Swain probably won't answer very specific personal medical questions. Generally speaking, he will answer to, and I've also given him permission to say, I can't answer that anytime, so don't be offended. I told him to say that. And then those folks watching along in the chat, I'll be posting the recipes in just a moment, but use that chat to ask your questions so you can interact with what's happening here in the room as well. Lastly, at the end of today's program, you all should receive a survey. I'm also going to post in the chat. Please use that to tell us what other cooking classes you'd like to see. Allison and I are starting to scope out 2025 already because it's going to be here in 5 minutes. So let us know if there's any other medical or cooking specific, ingredient specific, whatever the case might be. So without further ado, Allison's going to introduce and let us know what we're going to be eating today.
Yes. Hello, welcome. Thank you for coming to the Nutrition Theater live and online as well. Today we are going to be making an adzuki bean stew, and we're going to have as an appetizer edamame guacamole, and we are going to be making a beet and citrus salad. So first I need to get the soup started because that takes a little bit of time. So I'm going to get the soup going, and then we will discuss the topic today. So first, I've heated up my pot, and I'm going to put in some extra virgin olive oil. This is high in omega-3 fatty acids, which helps to reduce inflammation. I'm going to share with you my kitchen gadgets. I love my time-saving hacks in the kitchen and less cleanup. So here is my favorite olive oil dispenser. I'm going to add that into my pan, and then I'm going to saute my onions for a little bit. And once that gets cooked and softened, then we will be adding some of the other ingredients. Lower that. All right, and feel free to chime in now. Let me get a... How long have you been working with Advent Health?
A year and a half now.
Nice. Okay. And you specialize in PCOS?
Not PCOS, gynecologic surgery.
Okay.
Mainly, but we usually have patients who will consult with me regarding PCOS.
Nice, nice. All right, so here we have our onion, and we're going to also add some garlic once the onions start to get softened a little bit. I have this cool mincer. This is new to the theater today. I can't stand the garlic mincers that you squeeze because it's so hard to clean. So with this one, you just take the outer paper off of your garlic and you rock this tool on the top of it and it minces it for you. So I find this to be easier to clean. I'm all about, I hate having a messy kitchen. And if you're taking the effort to clean or cook, I don't want to deal with cleaning up. So then I'm going to put that in there and let that stir. Okay. You don't want to let your garlic burn because then it can get a bitter flavor. So you want to reduce your heat to low when you're adding in your garlic. All right. Okay. So here we will cooking this down for a little bit till it becomes translucent. Then I'm going to add my adzuki beans. The adzuki beans are rich in folate, potassium, calcium, and iron, and these are all baby-making minerals that are really important. They help build bones and muscles. So I found these I didn't find in Publix. They may be at Sprouts or Trader Joe's or Whole Foods, but I unfortunately don't have one near me. So I bought these on Amazon. So what I needed to do last night was soak them overnight. I don't usually cook with dry beans. When you do that, you typically have to soak them overnight. So I already pre-soaked these, so I'm going to add my adzuki beans to this.
So when you soak them, you just put some water in them?
Just
That's it?
water.
In the fridge?
And I left it in the fridge. You could leave it on the countertop, but I put it in the fridge, and then I just strained the excess water out. It was shocking to see how much water was absorbed in the beans. I didn't think it would happen. I'm like, wow, there's hardly any water in here now that I put it in there. So make sure you put a lot of water in, because if you don't put enough, it wouldn't be absorbed into it. So I'm adding my beans. This also has the seaweed, also known as kombu, and this has additional minerals in it, specifically iodine. Sea vegetables have iodine in it, and the CDC has found that women's age 25 to 39 are borderline sufficient for iodine, and iodine will help decrease the risk of mental retardation in babies being developed in the womb. So that was interesting to me, and you know why? I think we're deficient in iodine because they made salt iodized salt for a reason, but we are going with Himalayan salt or all these other salts, and they don't have as much iodine in it. So sea vegetables are a great way to add it, or buy iodized salt and use that when you're using sodium. And then what else? And then my stock. Okay. So I am making more than just the recipe that you have printed out, so don't count my volumes. They're going to be a little bit different. And since I'm they didn't have low sodium vegetable stock, so I'm not adding salt to this. We can always add it later. Hold on, my fingers are from the garlic. Let me wash my hands. Yeah, do you want to try? Get a man in here. It might be my fingers were with the garlic.
Seems like.
Thank you so much. Awesome. Okay, so I'm putting in.
And Dr. Zwain, while she's doing that, I was just going to ask, and you can step a little closer to Allison if you don't mind. I'll put the camera. But, what is your first initial conversation you have with patients? I mean, I think we know, especially when you're dealing with something like PCOS, there are health concerns. But what role does nutrition play in their overall health?
Yes, so when it comes to PCOS, we see that obesity are often found with patients with PCOS. Having said that, doesn't mean that all patients with PCOS have obesity. Actually, studies shown that 20% of women diagnosed with PCOS have normal weight, okay? And the obesity also plays an important role in PCOS. So part of the conversation I have with my patient is the importance of weight loss, okay? One of the
Set timer
other
for
thing
30
that
minutes.
we find with PCOS is insulin resistance.
Do you want
Okay,
Right there.
so
I can bring the
weight
plates to
loss,
Yeah.
low carbohydrate diet can help with that. And when it comes to PCOS, one of the common questions I get asked is, what type of diet should I follow? We don't have studies that examine certain type of diets like Mediterranean diets or high protein diet, but generally speaking, diet that's low in carb, high in protein is recommended for two main reasons. A, it helps with weight loss, and B, it helps with the insulin resistance.
And I find also it's low refined carbohydrates. The whole food carbohydrates are healthy for you. So if you're going to have some carbs, look for things like sweet potatoes. That would be a healthy fiber-filled carb. I like to focus on fiber-filled carbs because that extra fiber also helps you filter out excess hormones in your body as well, keeps you full and satisfied. That will also help with weight loss as well. So increasing your intake of vegetables, non-starchy vegetables is really great to increase your fiber. And I always tell people you want to focus on at least 30 different plants in 1 week. And often people are like, what? That's insane. But it's not just fruits and vegetables, your herbs, spices, your count as well, lentils, edamame, those nuts and seeds, those all count towards your goal. So at the end, we'll count how many different plants that we had in our menu today. And that will also help support your gut microbiome. And in our gut, we have good bacteria and bad bacteria, and we really need to make sure we have a good balance. So that will help decrease inflammation. It also helps decrease diseases like obesity, diabetes, cardiac disease, and inflammatory diseases, PCOS, and things like that. So supporting a good gut microbiome is really good as well, and increasing your fiber, and then healthier carb sources, not the refined carbs. There's so many refined carbs in the grocery stores, and it's so easy to get. So you kind of have to be intentional and make some shifts on what you're enjoying to eat to have the healthier carb sources.
Exactly. So the key here, as Ellen said, is complex carbs. One example for that is the sweet potato.
Mm-hmm.
Another example is brown rice. Okay, these are complex carbs. When it comes to breads, I personally, I love bread. It's really hard to give it up.
Yes.
But when you try to eat bread, try to choose the whole grain. Okay, again, it's the whole grain, not the whole wheat. Because
Yeah.
it has higher fiber content. And the whole idea is with higher fiber, the digestion will be slower, and your glucose spike will be less, resulting in less insulin and more weight loss.
And also adding healthy fats can help stabilize those blood sugars as well. So I
Exactly.
like the avocados, the olive oil, avocado oil, things like that will help stabilize that blood sugar. So I don't ever like people to eat naked carbs. So you want to think about how can I pair a healthy fat, protein, that's going to help stabilize that blood sugar as well.
And also help with satiety.
Yes.
So it will make you feel fuller, longer. Because one of the things of simple carbs, you'll eat, glucose will shoot up, insulin will increase, blood glucose becomes low, and then you're hungry again.
What is your opinion on whole grain and other products like pastas?
She's asking about what do we think about whole grain pastas?
Yeah, it's,
I love pasta.
you can do.
Hard for me to give up.
Yeah, we can eat whole grain pasta. Again, full disclosure, I'm not a dietitian, okay? But that's just what I do, what I personally eat. You can do whole grain. You can do chickpea pasta also, if you like pasta. And my personal experience, there's not a lot of difference in taste. It still tastes good. Like the whole grain pasta and the chickpea pasta, I still like it. I don't feel much of a difference. So it's a good alternative, okay? The important thing also to keep in mind, like we always focus, healthy diet, vegetables, right? Healthy fats. Avoid this, avoid that. The key here is moderation, like everything else in life, right? Moderation, we're all humans. We like some stuff. Sometimes I like a good cheesecake, right?
Mm-hmm.
I can even eat it once in a while, but it's not every day. So we go back moderation for me personally, not as a physician, as individual, moderation is key.
Yeah. When you're talking about desserts, I like to pick out one favorite dessert that you love, that that's going to be something you're going to enjoy when it's presented to you, and something that's not very often, like cheesecake. I don't have cheesecake in my kitchen very often, but if I go to someone's house and they have this beautiful cheesecake, and I feel like I want to enjoy a small piece of that, you can, but everything in moderation. For me, it's Baskin-Robbins chocolate chip ice cream is I love that, but it's not near my house, and I'm not going to get in the car and drive over there to get it. So, and every time I drive by it, I'm not going to get it either. It's just it has to be a perfect situation. So we're not saying you can't have some of things ever, but you just have to be mindful. Is it worth it? Because I don't like to live in a world of, oh my gosh, I'm so restricted, I can't have anything ever, because then all you focus is that. So let's focus on all the healthy stuff that we can add to our plate and crowd out some of the not so healthy stuff, because once you start shifting your diet to eating whole foods and really focusing on reducing the refined carbohydrates, you are going to feel much better and crave those whole foods and reduce the whole food carbs, plant or fiber-filled carbs more than those refined sugary things.
Allison, what are you working on over there?
Right here, I'm making the edamame guacamole, and my neighbor gave me a bunch of his avocados, so I wanted to try one of them, and I bought some avocado from Publix. And when you're cutting avocado, you don't want to cut it like this in your hand, because I don't know about you, but I don't like spending time in the hospital any more than I need to. So I suggest you put it on the cutting board. In the emergency room, it's called, I think they call it avocado hand, because do you work in the hospital? Okay, yeah, yeah. So you want to make sure you're doing it on the cutting board. And I like to just slice it like this. You can have strips of your avocado for a sandwich or a salad. You can dice it by going like that, and then I scoop it out with my spoon. And this is a great source of healthy fats to help anchor those blood sugars. And we're adding in a protein source to this, edamame, that's soybeans. So that's a plant-based protein that we are bumping into that to make it have even more protein to anchor those blood sugars as well. I'm going to give you tortilla chips to use with it, but also veggie chips. Whenever I serve my dips at parties, I like to have two options for dipping, and often the veggies go first. So it's and it looks really pretty on the plate. You eat with your eyes first. So I'm added my edamame, now the avocado. I'm going to add in my cilantro. I like to store my cilantro in a glass on the counter or in my refrigerator. It tends to last a little bit longer. And since I'm putting this in my Cuisinart, I don't need to worry about picking off every little leaf, all right? I'm all about being efficient in the kitchen, because when I work with clients, they're often like, I don't want to spend time in the kitchen, or I don't know how to cook, and I get it. You're not born knowing how to cook. So I just encourage people to get in there and just get their hands dirty and try. But if you can find shortcuts, that's a game changer. So I'm adding in my cilantro. We need to add in a little bit of garlic. So let me show you how. Oh, six cloves of garlic. That's going to be yummy. So to get the paper off the garlic, I just trim the edges off of it, and then I take my frustration out and slam it. And then it makes it easier to peel off the paper. I've also heard that you could put it in like a mason jar and shake them up. You could do that, but I don't want to clean that mason jar. And then I also have this silicone little rolly thing that I could do and use that as well. So I'm just going to coarsely chop that, so that, because the Cuisinart is going to do my job for me. And then I'll finish doing that, but I want to show you to the jalapeno. So take the lesson from me. I'm going to put it in the same. I have contacts, and I was cooking, and I cut up my jalapeno, and I washed my hands super good. I spent the whole day, hours later, washing my hands multiple times, and I took my contacts out that night. Oh my gosh, it was the worst pain. The worst pain. So I've learned my lesson. Use a glove. If you don't have a glove at home, then you could use a paper bag, a Ziploc bag, and just protect that hand because it really hurts. And I'm taking out the seeds. The white part, the pith, actually is spicy as well. So you want to make sure you scoop as much of that out. I personally love spice, but I know not everybody likes spice. So I'm just coarsely chopping this because, again, it's going to go in my Cuisinart to be all cut or chopped up. And I want to tell you, too, don't scrape your knife on the cutting board. It dulls your blade. You can use the other end or a bench scraper, which is missing today, but that's okay. And so you could use the back. You could use your hands and to grab it. And then I want to point out over here, this started boiling, so now I'm reduced. Thank you. This is the bench scraper, okay? So when you have cut items, you want to use this to pick up your food and move it to wherever you want it to be. This is will save your blades. I've gone to the farmer's market. There's a guy named Grumpy. He sharpens your knives, and he yelled at me. He's like, "You're scraping it on your cutting board, blah, blah, blah." And so I learned my lesson, and it lasts like quite a long time if you take care of your blades. Those sticks that come in your butcher blocks, those don't sharpen. Those just maintain your blade. So I also heard a rumor that from my husband that if you go to Bass Pro Shops and you bring your knives, they'll sharpen them for free. But I don't know if that's just to get me to go to Bass Pro Shops. I haven't tried it, but I was teaching a class on prostate health, and one of the guys in the class is like, they'll sharpen your knives, but it's like your hunting knives, so I don't know. And I do feel weird walking into Bass with my knives, so I haven't tried it out yet. So look for the guy at the farmer's market. I think that would be the best option. And then, so here I brought it to a boil, and now we have to reduce it partially covered and simmer it. Let's see if I have a cover for this. And if not, and it's partially covered, so this will work. Oh, there it is. Thank you. So there you go. All right. Set timer for 20 minutes. All right. So there we go.
So as she's making the guacamole, Dr. Zwain, I'm going to give you the chance, the myth busting that we get every question. Soy. I know this comes up a lot more with the oncologists and the doctors, but so many women are still afraid of incorporating soy into their diet. Do you have any opinions on that?
I mean, we go back, it's back to the moderation, right? I mean, you can have soy in your diet, right? But not in excessive amount, okay? Diets high in soy could be associated, could put women at risk of developing fibroids, okay? Again, it doesn't mean that we should never eat soy. You can still eat soy, but I believe we should avoid soy oil, like all types of oil.
Soy can also help reduce testosterone, from what I've seen, and cholesterol and LDL cholesterol, and reduce your insulin, inflammatory markers. So adding it in moderation, I think, is definitely a great idea.
And I think your point there, too, the whole soy is probably the preferred, the way she's using it there,
Yes.
in a tofu
Yeah,
versus
the textured soy powder, I don't like that. And
Yes.
we're trying to do the least processed foods. So that does require cooking, going back old school like our grandparents were,
Yeah.
not buying those convenience items that you're going to see in the grocery store and relying on those.
And one other thing I wanted to mention, just back to the point of simple carb, is the added sugar. Unnecessary added sugar to your food, okay? What I personally use, everything I buy from the grocery store, I look at the ingredient and how much added sugar, right? The magic number I need you to keep in mind is 4 grams. Each 4 gram is 1 teaspoon of sugar. How many teaspoons of sugar you put in your coffee, if you drink coffee?
Oh, I don't even use sugar. I use stevia or
Monk fruit?
Monk.
Fruit. I use monk fruit. Anyone here? How many do you put?
about a teaspoon.
About a teaspoon, right? In cup of coffee. So one of the unfortunate things, sometimes if you go to this grocery store and you try to buy bread, right? Some slices of bread, they will have 4 grams added sugar. 4-gram added sugar is 1 teaspoon. So if you want to make a sandwich, that will be 8 grams. So you just basically added 8 grams of unnecessary sugar to your meal. Another example, ketchup. Sometimes 1 serving of ketchup has 4 grams of sugar. Again, a teaspoon of sugar. Do we need that?
And
So-
that's in 1 tablespoon of ketchup. Who eats 1 tablespoon of ketchup? We're eating a lot more. You do?
No, we got the sugar, no sugar.
Exactly.
Is it Primal Kitchen? Is it the Primal Kitchen brand?
It's actually the Heinz ketchup. It's
Yes.
without sugar.
Make sure you read the label and see if it has artificial sweeteners in it. That's
Yes.
what you need to be careful of, because we focus so much on reducing the added sugar, but they're sneaking in some stuff that's going to mess with
Yes.
our gut microbiome. So
And-
look for that.
And you can tell by the taste. I mean, yes, it's different because I use the sugar-free ketchup also. It's a little bit sour. Okay? Yes. I mean, I like sour stuff. I don't mind it. I know some people, yes, they will prepare that. But these are the things that we need to watch. Juices, right? All juices are healthy. If you read the package, it has 20 grams of natural sugar, like from the juice, and then added another 20 grams.
Yeah,
And that's a lot of
It's
sugar.
a lot of sugar. I was did a presentation yesterday for the Rotary Club, and I was talking about added sugars, and I had a picture of my son like looking at a soda can. We were on a field trip, so it was a special occasion, and it was lemonade. So I thought that'll be better than Coke, and his face was like, ah. It had 40 grams of added sugar in that can. And how often are people just chugging down soda? And a lot of times it has high fructose corn syrup in it, which is really bad for your liver and can cause inflammation, weight gain. And the diet sodas aren't any better. It tricks your brain into thinking you need something sweet, and then you're constantly craving that sweet, sweet, sweet. So sparkling water would be great with your own fruit in it. And then just paying attention to the back of the label of some of your favorite items. Look in your pantry now and see what's in some of your favorite items, and you might be surprised. For women, the upper limit is 25 grams of added sugar per day, but even less is better. So,
And Dr. Zwain, when we met, you told me what you do with your yogurt. How do you do your yogurts?
So I just buy plain yogurt, and I add fruits to it. Because the healthy, fat-free yogurt, if you look at the ingredients, can have 20 to 24 grams of sugar. We're talking
yeah, it's like
about-
ice cream.
Yes, we're talking about 6. This is dessert.
Yeah.
This is not breakfast for me. Okay? Hmm?
Fat-free yogurt, you're saying, has sugar?
No, I'm saying the like the different yogurt type you buy from the grocery store. What the common brands? I don't know. I don't buy it, so yeah, then exactly like that. So
The
yes,
fat-free might have sugar in it
Uh-huh.
too. Not plain. They wouldn't have plain Greek yogurt. Typically does not. But
Yes.
if you find a fat-free strawberry, it probably has sugar in it.
Yes, it will have
Yeah.
a lot of sugar. So I'd rather have the fat from the milk or the yogurt better than the sugar, added sugar.
Yeah. All right, onion. Okay. I'm running out of space in this thing. I might have to do a little less onion. I want to show you how to cut an onion. You're going to cut it down the middle and keep the root intact. So that will hold all the pieces together. And cut the tip off so you could peel off that outer papery part.
And as she's doing that, that bowl you all see there is our composting bowl. So here at the center, we're partnered with O-Town Compost to compost our food scraps. So we use it at Nourish Coffee Bar and Kitchen. So it's a great program here locally if anyone wants to check it out. And it's a way to kind of reduce our footprint with our kitchen waste.
Yeah, and they'll either bring you back some healthy soil for you to garden yourself. I personally kill everything I put in my garden, so I have a tower garden that doesn't need soil, but you can donate your compost for them to give to some other gardener locally. I've seen a lot of homes downtown that have gardens in their front yard. I think that's really cool. Then I wouldn't forget it and I'd water it. But
Yeah,
I
that's
forget
another
it.
part of us, fleet farming. They come
Yeah.
here and do our garden education classes here at the center. So they will work with folks to put them into their yards.
Yeah. I want to show you my favorite gadget for chopping things up. I like to do what I call salivar in my fridge, where I cut my veggies and have them in glass containers so that I can see what I've got and my kids can see what I've got. And it's like reduces the barrier to eating something healthy. So if I'm feeling hungry and snacky before dinner, and I open up my fridge and I see a whole red pepper, I'm not going to cut it. I'm like moving on. But if it's already sliced up, yeah, I'll go grab it. But for this, I take out my frustration and I can just easily chop up my ingredients, and this saves me time in the kitchen. So if you're someone that's like, I don't have time to cook, I don't want to deal with all that, I don't know how to cut all my stuff up, get one of these. This is great. So there we go. All right. And do.
Allison, I'm going to ask Dr. Zwain another question now, if you're okay.
Okay.
So somebody in the comments, Dr. Zwain, went back to your comment earlier about the brown rice, the nutritional benefits, and she said she had read somewhere different that there was no nutritional difference between brown and white. So, I mean, I think that's one of those things we all can read different things everywhere, but I guess first talk to why is brown rice better, do you think? And how do we, as consumers, deal with, sometimes completely conflicting nutrition information online? Is there some sources you like to go to, or any sort of buzzwords we should look for to know what's a trusted source?
Can I
So-
pause before you say that?
Yeah, please do.
So I could just.
Yeah,
Yeah,
go
I
ahead.
don't want.
go
Yeah.
All right. Sorry. So as you can see, I overstuffed this. So I'm gonna mix it all up and push it down so it's all blended really well. It will blend, but sometimes you have to put your spoon in there and push it down. One more time. There we go.
You couldn't do this one tableside, Allison.
I know, I could. And if this is a little bit thick, you add a little bit of water to it. All right, you can speak. I'm going to get some water.
Water. Okay, so back to that. When we're talking about the brown rice, it's a complex carb. Okay, so her question was
But the nutritional difference between brown and white rice. So I guess it's more has to do with the type of carb it is versus the nutritional difference.
So nutritional, I'm not sure. Probably
It hasn't been
Elsie can
stripped
help.
of the brand and all the fiber with it. There's more fiber in the brown rice. So I haven't heard the brown rice is not, as good. To me, brown rice is better. I haven't heard that it's equal to
Yes.
white rice. So brown rice has more
Exactly.
fiber in it. It's going
And,
to keep you
I've
satisfied.
heard also, and again, this is not from medical literature, that white rice has very minimal, nutritional value.
Yeah.
Okay. I personally love white rice. Okay. I eat more white rice than brown rice. But I think the important question here is trusted resource, right? Because now if you consult with Dr. Google, you go to the Instagram, and you see these influencers who are experts now. But if you look at their credentials, probably nothing. So what do you think is a good resource we can go to when it comes to nutritional value?
A
Allison?
dietitian. Plug. No. I like today's dietitian is a great resource. I like Healthline has a lot of dietitians that speak on their blogs and things like that. Your local community hospital has tons of dietitians that work there as well. So I think
Yes.
meeting with someone that's actually studying nutrition and can definitely help you.
And one of the things we did in our family is we started mixing the brown and the white to get, especially my husband who wasn't a fan of the brown
Yeah.
rice, used to it,
Okay.
and
Yeah.
that's been more successful too. So now my daughter, my teenage daughter, actually prefers the brown rice over the white, but we're still working on my husband.
Yeah.
So
So my question for you will be, how would you cook it? Because
Well,
they have different cooking
you're probably going to
times.
yell at me that those plastic packs are probably terrible
I
to
know,
cook them
no.
in, but I do get them a lot because they're so convenient.
Put them in your in
Put
a
'em in-
glass
dump 'em out of,
bowl.
and I learned
Yeah.
that from Allison. I
Yeah.
still will buy them in those
Yeah.
plastic packs that just need to be reheated, but I dump it into a glass bowl
Yeah.
to heat it in the microwave.
So you cook them together or separate
Well, I
and
cook
then
them
you
separate,
They're
and then I
already
kind of
cooked.
give some a little
They're
bit of more of
pre-cooked.
each.
Seeds of Change has pre-cooked and
Uncle
minute
Ben's
rice,
and
Uncle
right, all of
Ben's.
them.
They're already pre-cooked, and also with pre-cooked rice or pre-cooked potatoes that have cooled down, it creates a resistant starch, so your body's not going to absorb all the carbohydrates as if you were to just cook it and eat it right away. So I just recommend putting it in a glass container if you're going to do that. And honestly, I do that at my house as well because I don't feel like wasting the time to boil the rice. Not many people in my house eat it. If I'm going to take the time, I'm making a big batch, freezing it, and then I can break off what I want if I want a little bit of rice.
And that's another thing I do. I get at Trader Joe's the frozen rice too, and they have a brown and a white rice. So sometimes I'll cook both, heat them up. So
That's all. I need to do this noisy thing. Hold on a minute. All right, hold on. Let me just do one more zhuzh. And I'm going to have tortillas with this and some of the veggie chips. All right. Let me put this in a serving bowl and we will pass these around.
Allison, I know it'll be in your link. Somebody was asking, what was the name of your chopper? Does it have a name, or when you Google it?
If you sign up for my email, I'm going to send a link to my Amazon store with all my favorite kitchen gadgets. I don't know the name of this. This is the second one I've purchased. The first one I got was from Aldi, but they didn't sell them there anymore. And so I just looked up online. But the blades are really, 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 really sharp, so just be very careful. Thank you. I wanted to show you, too, before I pass the veggie chips, how to cut a pepper. The seeds are so annoying. So what I do is I just cut on the side. I see where the seeds are at, and then I just cut around it so I don't have to deal with cleaning up all those darn seeds. And then at the bottom, I'm going to have this square or rectangle. I'll chop that up for my salad. So if I'm using this for veggie chips, I'll slice these up, and then I'll use that bottom one for a salad. All right. So let me get here's some tongs for you to grab some chips, and I'm going to put this in a serving bowl for you. Go. Okay.
So Allison, do you add salt, black pepper, your guacamole?
I'm going to add a little bit to the top and mix that all in, and let's see what kind of salt we got over here. So we got sea salt. I'm going to use just the regular salt. But I like the iodine. So I'm just going to use our salt and pepper shakers and add a little bit here. I typically don't add salt to my stuff because you can always add it later. I've kind of trained my taste buds not to crave the high sodium stuff. All right, there we go. And Here you are. And I will give you guys tortilla chips too, as well. There we go. Do we have a... And then, all right, next I'm going to move over here. I need to add the butternut squash. Okay. Let's read. Always read your directions. Add... 20 minutes for a Okay. So I will send you a video on how to cut butternut squash. The butternut squash is a really hard vegetable, and it takes some effort. So I like to do shortcuts in the kitchen. Yes, you pay a little bit more money, but if that's going to help me get healthy foods on the table faster, I don't mind doing that. But I will share with you a video of how to safely cut your butternut squash in the follow-up email. And I'm going to mix this all in. And if you need salt and pepper added, let me know, because we can pass around the shaker for you.
You know, one of the things, again, this is not medical, but one of the things I add to guacamole when I make it home, cumin.
Oh, yum.
Yes, cumin adds a very nice flavor to it.
Yum.
Yes. Yeah.
I have right by the stove, eggs, it's really good.
Yes, and with the lentil soup also. It's really
I
good
like
with the lentil
cumin.
soup. Yeah. And another alternative to the chips I make at home is pita chips. So you basically...
You make what? Pita chips?
Pita
Yeah.
chips. So you just buy pita from store, cut it, air fryer, olive oil, salt. It's also good. With the guacamole, with the hummus. With
Yum.
anything, yeah.
Well, you were speaking before about the Instagram influencers, the online advice, and it seems like every cooking or nutrition video I get these days is obsessed with protein. So what are your sort of general thoughts on protein, and what are some of your favorite sources of protein?
So, you know, protein is an important component of our diet, right? So if you go, you know, the healthy plate, when you're trying to prepare your meat, should be third, and third, right? Third protein, third vegetable, and third carb. When it comes to
Set
protein,
timer for 20 minutes.
I mean, I'm open, right? When it comes to low-fat protein, again, this is animal source, not vegetarian source. My go-to usually is the chicken breast. You want to I have also protein shakes, like I make my own protein, not make my own, but like protein with, I usually add fruit to it, either strawberries or bananas or blueberries as another source of protein. So Alison, what's your favorite plant-based proteins?
I eat, I'm not a vegetarian, I'm plant-powered. I do like to eat, add more plant proteins to my plate, but I do like chicken as well, and turkey. I love edamame, and I've grown to really like tofu. And I make some of my favorite dishes with tempeh. I like nuts and seeds. Those are really great. I like plain Greek yogurt, cottage cheese, the eggs.
Yes.
Those are all delicious.
Well, I keep thinking cottage cheese is the new cauliflower. Like
Yeah.
5 years ago, like people are using. I saw the other day somebody making cottage cheese bread.
I made it.
You did? You tried it?
I tried it. It's pretty good. I made a wrap with it, but you got to eat it right away. I saved it, and then I was like, I'm over it. But it was easy to make, and I made. I'm gonna post this on Instagram soon. I made I was trying 2 different recipes. One was a cottage cheese blueberry. It's like a cheesecake, but it's made with cottage cheese. So I made that. That wasn't so good. I think it was probably because I used frozen berries and it was too liquidy. And then I made a pumpkin cheesecake made with cottage cheese. And then I sprinkled some dark chocolate on top. Oh my gosh. Because I wasn't hungry for it. And I was like, I got to take a little bite, but I don't want to ruin it for the picture, you know? And then I took the picture and I kept going back in there and digging in. I'm like, I'm just eating the whole darn thing. It's so good. So yummy. All right, here I'm making our beet and citrus salad while you're eating your appetizer. And we are using a champagne vinaigrette, or vinegar for this. I've added my olive oil, and we're taking some of the juice from the oranges. So I noticed that I didn't really have enough juice from the oranges to add to this, but I had more grapefruits than oranges. So I'm like, use it as a template. It's a citrus. So I'm like, I'm going to mix it up. So I've got some grapefruit and orange juice in there that I squeezed. Then we are going to be using 3 teaspoons of honey, which is actually 1 tablespoon. I encourage you to buy your honey at local farmers markets because it comes from local bees and that helps reduce allergies. So you want to use raw, unfiltered honey, not the one that comes in the little cute little bear, because this is slower for your body to digest, and you don't get the spike like you would with the processed honey. And then,
Quick plug, come to the Commons Co-op on November 6th. We will have our honey vendors here.
yay!
It's a good event to shop for the holidays.
Perfect. All right, so here we have our vinegar, honey, and all right. So I'm gonna wash my hands and get gloves on because I'm gonna massage the kale. I know in the recipe it says baby kale, but when I went to buy my ingredients, there was no baby kale. And I really wanted to have kale for this recipe, so I'm showing you, just because you don't have an ingredient in a recipe doesn't mean everything is lost. You still can make adjustments, so swapping out the type of lettuce. And I often hear from people they don't like kale because it's too tough, it's bitter, and when you massage it, it actually changes the coloration. It's like vibrant and beautiful, and it isn't as tough and it's not as bitter. So if you don't like kale, I encourage you to try it today in a different way and see what you think. So since I'm gonna get my hands all in here, I'm gonna put on gloves so I can massage the kale. Before I do that, I wanna show you, you can buy bags of kale that's already pre-cut. And that would normally be my go-to because I like saving time in the kitchen. But they don't take the spines out; they just chop it. So you got all these like nasty pieces of hard, tough kale. So it's so simple. You just like pull it like that, and then you have your leaves, and you just rip it apart, and then put it into your salad. I didn't wash this, so I'm not putting it in the salad. Our composting people will enjoy that. And then, so I used my salad spinner and spun up and cleaned off this kale here. I'm going to add the vinaigrette. This works really well with a vinaigrette. Woo! Party. All right. So here we go. And I'm just going to massage it all up.
And as she's doing that, Dr. Swain, I see you're going to be adding citrus to that, right, Allison? Mm-hmm. Going back to sugars, I think people get afraid of a lot of fruits because of the sugars. Are all fruits created equal? Are there better fruits than others, especially if you're worried about an insulin spike like we were talking about before with PCOS or fibroids? What's your general recommendation in terms of fruits?
So, fruits generally are good. If you go into the details, which one has more sugar versus that, I think the berries are the lowest glycemic index, right?
Right.
Allison?
Yeah, I have
Yes.
a sheet right there about the glycemic index.
About the fruit, I think
It has
watermelon also
Yeah.
has low.
And
right?
it's like, it goes back to what you said about reading the food label, and we're worried about added sugar. Fruit has sugar in it. Dairy has sugar in it. But that also comes with fiber, vitamins, and minerals. So I don't ever recommend eliminating food groups at all. And that's going to help give you a lot of good nutrition. So
Yes.
I think the fruits are safe and great to add in. I don't really like fruit juice because a serving of fruit juice is only a quarter cup. Who drinks a quarter cup of juice? Nobody.
That's a shot.
Yeah. So if you're going to drink juice, I dilute it or just don't even get it. It's just like one of those slippery slope things. So
We did
but-
buy a juicer for like the hand press one.
Yeah.
You know, kind of like you do that. You know, so we do that with oranges sometimes. But
And then also, but then if you're adding in veggies to that, like those juice presses, that would be a great way to
Yeah.
offset the amount of
Yes.
sugar. But you just can go, it's so much easier to drink something than to eat something and chew it. And when you juice it, you're eliminating all the fiber.
Yes. And again, we're all worried about the sugar, but as Elton said, it has fiber. I mean, again, having fiber doesn't mean that it has lower caloric value. I mean, the caloric intake is still the same when you're eating the fruit. But again, if you tell me 10 grams of sugar with fruit versus 10 grams of cane sugar in your coffee, no, it's definitely different, right? I mean, and sometimes we all have cravings. After dinner, I have cravings. If I don't want to eat a cake, if I don't want to eat chocolate, I'll just have dates. Okay? Very sweet, yes, very high sugar, but it has fiber with it, and it's just natural, one ingredient food. Yes. I mean, it's really good. And also what I do, I usually get the majdoul dates. I just open them up, and I put the walnut in it.
Yummy.
Tastes really good if you're not allergic to walnuts. I mean, people put different things, walnuts, almonds, even pistachios, but I think walnuts with the dates taste the best.
I just took a dessert class here last week, and they did dates, and walnuts, and they mashed it all up, and it was like a pie crust. Absolutely delicious.
Yeah, I've made a fruit pie like that with the dates and the and different nuts. Made a crust, added some Greek yogurt, and then some sliced fruit on top.
And then just freeze it.
Yeah, so good.
Yeah, and sometimes you just, when you mix everything all together, and just make it as small balls.
Right.
That could be also just dessert. I mean, again, it needs more work. It's easier just to make the walnut in it and eat it, but
Yeah. All right, so here you can roast your own beets. They are very messy in your kitchen. They're very, the color, gets everywhere. But the way you roast beets is you're going to preheat your oven to 425. You're going to you're going to clean it. Then you're going to wrap it in aluminum foil, and you roast it for like 45 minutes to an hour, depending on their size. And then when they're done, you take them out, let them cool a bit, and then you just rub the aluminum foil on the beets, and it totally takes the skin off of it. And then you're able to slice it up. Or you could buy them already pre-made for you in the grocery store and make it a lot easier for you. So it's totally up to you. Sometimes I do roast my own beets, but other times it's a lot easier to get them pre-cooked for me. These were all sliced. And I was looking up the beetroots. They have an antioxidant in there that helps to reduce inflammation and helps with insulin sensitivity. And there's a natural food coloring called betanin, which has a potential to lower oxidative stress, lower LDL cholesterol, and those are some common issues with people with PCOS. So that's why I chose the beetroot for this.
When you were talking about the beets that you get in the supermarket, are you talking about the canned beets?
No, I just threw out the thing here. It's called Love Beets, and it's in the produce section, and it's over in Publix. It's near. Is it near the carrots? Okay. Yeah, they come whole, and I just found them sliced. So I was like, that's awesome. So, and I'm using some healthy omega-3 fatty acid nuts to add to that. So I'm going to chop a bunch of these.
does anybody have a nut allergy?
Oh yeah, any nut allergies? Good question.
yes.
So I'm just going to do a rough chop. I want you to look at this. You can see the half of a walnut. It looks like a brain. It has a lot of good nutrition to help with brain health as well. But I'm just going to chop up my nuts and sprinkle it over the top. I think this is a better way to add some crunch to your salads than adding croutons, which are typically buttered stale bread, So here we're getting a little bit of protein. It's another plant source and has the healthy fats. So I'll show you using the bench scraper. I am going to scrape this and put it on top. Boom. And then here we go. This is something you could serve at the holidays. I'm picturing getting a platter, having the bed of the greens, and then you could position the beets and then put the citrus on top of it. So we do eat with our eyes first, so be mindful of that. So I will pass this starting on this side this time.
So Allison, what's your thoughts on roasting versus boiling the beets?
I've only roasted them before, but beets are new into my diet because I thought they were really earthy until my coworker had brought me some beet juice, she made and had beets in it. I'm like, I really liked it.
Yes.
So, but when you boil, you're also throwing out all the nutrition in that water if you're not using it. So that's my hesitation with boiling veggies and food like that.
Mm-hmm.
If you're gonna, I'm just thinking out loud, like if you took that beet juice and then you made some rice with it, you know, boil your beets, keep the water, and then make something else with it.
I drink the water.
You could drink it? Yeah. You could.
Yeah.
Yeah.
Exactly. I mean, it's really good, especially if you add a little bit of lemon to it.
Of what?
Lemon.
Oh, yum. Yeah.
Tastes good.
All right, so here I am going to finish off the soup and let it simmer a little bit. It has ginger paste. This you can find in the grocery store in the produce section near the herbs. When I first looked at this recipe, it called for ginger juice, and I'm like, where am I going to find ginger juice? And I don't have a juicer at home, so I figured the paste would work just fine. So I'm just adding in some ginger, and that has some antioxidant properties in it as well. All right. And when you bring these home, make sure you write on it in bold numbers what date it is that you got them. I found a thing of basil hiding in my refrigerator, and it was very old. It didn't look old from the container, but it was very old. And that goes back to my, if you want more dressing, you can pass that around. It goes back to my spice racks. If you have a spice rack that you got when you got married at your bridal shower, chances are they're expired. So your spices only last about 6 months to a year, and your spices have medicinal properties in it, so you want to make sure that you are swapping them out if they're old, because your recipes aren't going to taste as good, and it's not going to give you all that extra added nutritional benefit. And then tamari. I'm adding in the tamari and 3 tablespoons of tamari. This is an alternative to soy sauce, so if you are gluten intolerant, this is a gluten-free version of a soy sauce. I am not gluten-free, but I like this because I can get the least amount of sodium in this version compared to low sodium soy. So mixing that in. All right, let that simmer. And for your scallions, when you're keeping them at home, keep them in your water. When you cut them down, you just put the ends back in the water and it'll resprout. So you could have scallions for a long time without having to go buy yourself some more scallions. So here, I'm just roughly cutting some of the green onions to go over it. So what do you think of this salad? How about the edamame? Cool. Good. I like making my own salad dressings because I can customize it to what I like, and I know I'm getting a healthy oil in it. If you go to the grocery store and you look at all the salad dressings, very few of them are made with olive oil or avocado oil. They're often made with seed oils, canola oil, and those are inflammatory. The reason why they do this is because it's cheaper for them to use those less desirable oils. So if your salad dressing, if you put it in your refrigerator and it doesn't solidify, that means they've used a more inflammatory oil. So even if it says like olive oil and vinegar dressing, chances are it's a combination of olive oil and other oils in it. When I was at UF in my new dietetics program, I had to take a food chemistry class, and one of the labs we had to do was test popular Italian chain that's around here by Millennia Mall, salad dressing that has olive in the title, their olive oil or oil vinaigrette dressing, and there was like barely any olive oil in it. I was shocked. I'm like, oh my gosh, they lied to us. So you really have to look at the ingredient list. So don't trust the front of any package and your favorite foods. You always got to turn it over and see how pure is it? How many chemicals are in it? How many other seed oils are in it? For instance, this honey is raw honey. There's one ingredient. When you buy peanut butter, buy peanuts, maybe a little bit of salt. That's it. You can find maybe one or two on the shelf. It's very sad. But you got to be a supermarket sleuth and look at the ingredients on the back.
Yeah. The other thing about olive oil, it needs to be extra virgin olive oil. And second thing to keep in mind when you buy it is cold pressed. Okay? Because sometimes if they use heat, when they're extracting the oil, can affect the quality of the oil. So extra virgin olive oil, cold pressed.
There's my mic, sorry. We're going to lose Dr. Zwain in a minute because he's very busy and he's given us so much time, which we appreciate.
Thank you.
Before you go, just, for women, especially dealing with PCOS or fibroids and they're struggling, and, what's sort of your takeaway for, how they can take control of their health, and, what's your parting advice you give to your patients when they come to see you?
So, always when you feel that something is not normal, something is not right? Like, for example, when it comes to fibroid and to a cycle, if you feel that it's just too much pain, you have to quit what you're doing. You cannot leave home. You cannot go to work. This is not normal. Always consult with your gynecologist, okay? Do your own research, right? Yes, again, I personally don't recommend consulting with Dr. Google and going into these forums and you hear these horror stories, okay? We need to go to a trusted websites. Like one of the websites I recommend to my patients is the American College of Obstetrician and Gynecologist, okay? There's an excellent website called uptodate.com. So if you go to this website, uptodate.com/patients, that's a great resource. You can put the symptom, you can put the problem, and you can find some evidence-based, valuable information. Have a second opinion, right? Every one of us has the right to have a second opinion. I was playing soccer and I hurt my knee. The first orthopedic I saw, they said, you need a surgery for ACL reconstruction and medial meniscal repair. I had a second opinion before doing the surgery. So nothing wrong. And sometimes even I suggest that to my patients. Okay, these are the options. These are my recommendations. And you have the right to get a second opinion. Just to make sure that this is the best decision for you. The other thing also, yes, we always talk to friends, talk to family, okay? Go to forums, join Facebook groups. I've heard there's a Facebook group about the fibroids, has like 10,000, 8,000 members, right? What worked for one woman doesn't mean that will work for you, okay? What's good for you, not necessarily the best option for the other person, right? So there's a lot of variables, okay? It's not only one problem. When it comes to any medical issue, right? So these are my takeaways. Always consult with your physician. If there's no improvement in your symptoms, it doesn't hurt to get second opinion. Okay, any questions for Eileen? Okay, thanks everyone.
Thank you
Nice
so
meeting
much.
all of
It was
you.
awesome.
Nice meeting
Thank
you.
you very much. Feel
Okay.
free to take a plate with you if you want.
Yes, I'll take some salad.
Okay.
Okay, thank you.
So what do you think? Has anyone dug into the soup yet? You like it? Good. The azuki beans were new to me, so I was excited to. Yeah.
I like it. I really like the ginger in that.
Yes. It awakens your taste buds. Yeah. I like that as well. With the edama or the guacamole, what I like to do is I'll take a pepper and I'll cut it in half and core it out, and then serve it inside that pepper, and then put that in the middle of the plate. Have your veggies around it or your tortilla chips and things like that. Yeah. And then I encourage everybody on the webinar to sign up for my email, because I will be sending some resources to this. Perfect. All right. Any questions in the theater?
All right, well, to our folks at home, we are going to end our video now. So thank you so much for joining us today. As a reminder, if you joined us late, or to the folks here, we're going to send around a link to the full recording to everybody. So share it with your friends and family. That'll also have the link to the recipes and Allison's website in there as well. So thank you so much, everybody, for joining us today.